such pandemic. Today we have to start with the topic that is called autopsy. So let's start it. So first of all, let's discuss with the objectives of today's lecture. That is, at the end of the lecture, you'll be able to understand what we really mean by autopsy, our aims and objective by performing the autopsy, what are the different types of the autopsy, difference between the medical legal and pathological autopsy, and what we really mean by autopsy protocols and legal formalities. So let's just do this. There are multiple synonyms for that. The autopsy is like, we can call it postmortem, we can call it necropsy, and we call it thanatopsy. So autopsy is basically it's a version of two basic words, that is auto, that is means self, and opsis means viewing, examining, or the self-examination. Or you can define it as the detailed scrutiny of both external surface and the external contents of the dead body after opening its cavities, including like cavities by means of saying cavities like brain, thorax, abdomen. Okay, cavities including further examination while taking different samples for the purpose of histology, biochemistry, toxicology. Take it, and we just collect the materials from that particular autopsy for to evaluate that where the foul play has been done. Or the purpose or the definition of the autopsy is the scientific examination of the dead body under the law of state to assess the identification and prosecution of the guilty in cases of unnatural death. Necropsy, it is again the same word and used as a synonym for the autopsy. Is necro means dead and opsy means examine to see, means examination of the dead body. Thanatopsy, again, thanatos means dead and opsis means to view. Now we come to the types of the autopsy. There are multiple, in many part of the world, or multiple authors says there are only two types of the autopsy. Basically, that we called it medical autopsy or that the medico-legal autopsy. But like for the sake of your understanding, I'm just dividing it into the multiple types, like medical, clinical, pathological, or a hospital autopsy. That is like synonyms to for for the one same. Then the anatomical autopsy, psychological autopsy, postmortem autopsy, virtual autopsy, and the medical legal autopsy. Now we will take it one by one. Medical or the academic autopsy. Medical or the academic autopsy or the hospital autopsy that is carried basically on the patients who died in the hospital during the course of treatment. Basically, we conduct for the medical reason to establish diagnosis in cases where that the clinical interventions become inconclusive. Such situations we perform the clinical autopsies. The objectives of these autopsies are to determine the cause of the death, basically to confirm or establish the clinical diagnosis. Basically, in cases of the trial cases, sometimes we put the patients on the different trials in the big hospitals, and we want to see that if the person is not responding, so which organ is not going to be respond on that. So we look for these things, take care to evaluate the effect of the treatment given during the life. So, and such kind of the autopsy is basically being performed internationally or by the pathologist with the consent of the relative. Here, in such kind of technique, the clinical autopsy, the consent of the relative is very much important. If they don't give you the consent, you won't be able to just pursue with that such procedure. If they said no, it means no. Now, number two, that is anatomical autopsy. Like it is performed for the purpose of normal structural human body structures to see, like as in my MBBS course, I go for that. When I go for that, the anatomy classes, usually we have to go for the dissection room first, where they have the embodied body, and they were just performing that the autopsy and showing us that the different structures on that particular body, like muscle layers, the course of the vessels, and they take it like chip by chip, for the academic purpose. So usually the anatomical autopsy is something that is related with that. Now it just become like it's not being allowed for the medical schools to perform because of that. There is a lot of hazards which are related with that, such kind of that the autopsy, because usually these kind of autopsies being performed on the unknown body. So you never know. Okay, either they were just infected with any kind of the contagious diseases like HIVs, AIDS. So that the articles has been proven, such kind of the cases like okay, infections has been transmitted to to the doctors from such bodies. So it become banned, like to perform these kind of the activities in the academic. Like now we have that the advanced techniques, like we have that the virtual kind of the autopsy, anatomical autopsy tables, in which that the people were just performing like internationally. Then we have the third one, that is psychological autopsy. This is that the kind of the technique which is not invasive sort of the thing. It is undertaken on the least cases of the suicides to know about the mental status of the deceased at the time of the death. Basically, being and as a medical legal officer, or the registered medical practitioner, like who was just performing the autopsy for the suicide cases, it's gonna be the utmost duty of that doctor to just go for the psychological autopsy as well. If he just come to like get that this is something which is related to that the suicide, then it is being performed to like data from where we collect that data, like what could be the source, like from that the we have to check like the background of the person ke uska personality kya tha, his habits, his mental status, personality trait, uska character, relationship with the friends and family. So we have checked all the scenarios to correlate such thing with like कि उसको हम उसके सुसाइड से in relation with the suicide check करते हैं. Then the where the data can be collected for the psychological autopsy. So psychological autopsy के लिए we will just preferably like take the data from the family members. We interview that the family members, friends. If the person has that the professional life, so we will take our close colleagues of that person and ask them that about his like whatever his habits, his status, either he was just worried about something. So kind of like an interrogation, but it is something which is totally different from like from the police, because you won't like be totally relying or dependent on that the statement of the police, or that the in such psychological autopsy you won't just like take all the things from that the police. This is your job to just perform that thing. This is non-invasive sort of technique. Okay, so the fourth thing is postmortem examination. Postmortem examination, but by the literally means it like it's the examination of external surface of the corpse by inspection without giving any incision for the systemic examination, without giving any kind of the neck. But in this kind of the procedure, a kind of the examination, however, the specimen of the body, fluids like blood, bile, urine can be collected. Usually like preferably like when we perform that the postmortem examination, when we receive the bodies like after like 5 o'clock, so it's mandatory to just perform like the postmortem examination, that the external examination, you look for that the whatever the changes are there, because internationally or now like here it is recommended that after the 5 o'clock you won't do that the autopsies, because of autopsy basically, keep that one thing in your mind, that autopsy is nothing which is called emergency. Okay, so it doesn't comes under the emergency situation. You can take your time while performing the autopsy until and unless that the legal litigation is going to be have that some kind of the hindrance, and they need that the report like earliest, but you are the one who is just performing it, so you can take your time. So postmortem examination, like multiple in areas, like they think it's only that the examination of the external surface of the corpse. Okay. Now, what is the virtual autopsy or the autopsy? It is the advancement in that the field of like forensic medicine that we called it virtual autopsy or the autopsy. It's a new and non-invasive form of the technique or performing the autopsy. This system basically utilizes the computer tomography, or we called it CT scan, or the MRI, magnetic resonance imaging unit, to obtain a detailed view of the body. Here, the MI images and the detailed X-rays are combined to create a full 3D dimensional view of the body, which the forensic pathologist or the medical examiner can use to examine the state of the blood vessels, organs, bones, and tissues of the body, and to determining the cause and manner of the death. In TKG in which the patient died, virtual autopsy can even bring light some crucial information regarding the body that is difficult or time consuming to acquire using conventional method, because in the conventional method you have to intervene, or you have to go through the whole entire body in deep and study each and every single viscera to conclude your diagnosis, or to make your diagnosis at giving it 100%. So it's a time consuming sort of job. But in the autopsy you have that the it's a customized system. So you have that the multiple windows. If you want to see that the bone windows, you can convert it on the bone window, you can look for the fractures and all that thing. Sometimes when you were just performing that the conventional autopsy, when you open the skull, you miss that the inner plate fractures. But while performing that the autopsy, you can easily see that the any linear sort of, or that the minor kind of the fractures, you can easily appreciate, which are very much have that the importance in the process of the death. Like sometimes we assume it's an homicidal attack, but it's gonna be it is going to be this the primary effect is because of that the some kind of underlying disease done that thing. But aneurysms, brain aneurysms, but they get burst up. So you never knows, these kind of the things you can easily be detected on that the autopsies. Then finally the medical legal autopsy, that is the essential examination of the dead body to rule out or to establish foul play in the dead. Basically, the medical legal autopsy is performed in the pursuance of the law to establish cause and manner of the death, and also to establish or rule out the foul play. What we really mean by that, the cause and manner of the death. Cause is something like either the death has been occurred because of disease, trauma, or any kind of assault. So you have to rule it out. And the manner of death, either the natural causes there or the unnatural. If it's going to be unnatural, then we have to look for what is the reason behind, either it's the homicide, suicide, or the accidental. So we have to establish that the all the parameters, we have to set that all the parameters. So it is performed under the section, because we lives in Pakistan, so we have to know our legal system. Okay, under which section we are performing it, or under which documentation we are doing it. So it is performed under the section 174 criminal proceeding court, that is CRPC कहते हैं, of Pakistan, and police rule 1934 section 25.34 and 25.36. Now we come to the what are the differences. So we have none with the types of the autopsy. That is, as I already told you, Kitty, there is a clinical autopsy. There are clinical autopsy ho gaya, anatomical autopsy ho gaya, then the postmortem examination ho gaya, autopsy ho gaya, then psychological autopsy, and the medical legal autopsy. Now we are moving towards that the other topic, that is the difference between the medical legal and the pathological autopsy. This is the basic thing, because internationally it is recommended that there is only two types of autopsies. That is, either it's going to be the pathological, or it's going to be like the medical legal. So medical legal, what is medical legal autopsy? Medical legal autopsy is done on the request of agencies appointed by the government to investigate in cases of unnatural, sudden or suspicious deaths. Take care. In such particular cases, the dead body become the property of the state. So no permission from the relatives is required. Take care, because that the body become like, because you have to rule out that the foul play behind that unnatural death or the suspicious death. So there is no need to just go for take the permission. Only that the authorities will provide you, the legal authorities will provide you that the permission, gives you the permission to perform that autopsy, and you will do that job. Pathological autopsy, as we already discussed, that is again that the another name for the clinical autopsy, is done on the patients dying in big hospital after taking the treatment, or in case where diagnosis could not be made till death. Like again, I told you, previously told you, like in cases of the trials, medical trials होते हैं different किस्म के, उनके अंदर जब something you have to look for that the particular course of the treatment, take care why it doesn't work, then you will look for it, to look for the success of that drug, that either it's worth of or not. You go for it, you perform that autopsy, and for that purpose you need the consent of the relative. If they say no, it means no. Identity of the dead body is usually not known sometimes, but whenever that the body is brought to you by the police persons, they will establish the identity, or maybe sometimes the relatives are accompanying with them, they will give you the identity, or sometimes you get that the unknown bodies. But in case of the pathological autopsy, is identity of the dead body is known, because it already that the admitted case, and you can take it out from that the case sheet in the ward where the person was admitted. So in the medical legal autopsy, cause of the death is mostly not known, and in the pathological autopsy, the cause of the death is usually known from the case sheet in the ward. Time since death is usually not known. Time since death means whatever that the time has been lapsed between that the recovery of the body until the time of performing the autopsy. So in central line time, the medical legal officer has to identify, by his expertise, he has to rule out. But in case of the pathological autopsy, the exact time since death is known from the notes of the case sheet by the duty doctor. External finding in cases of the medical legal autopsy are of vital importance. Why? Because that sometimes give you the exact clue, like cadaveric spasm. Maybe you will find something like any kind of the evidence related to what related with the assailant in the clinch palm or the fist. So in the cadaveric spasm, maybe you will get something, or by the Lockhart principle of exchange, whenever the two things comes in contact, they will always exchange of the material will be there. So because, as I said, keratiology, unknown body has, so maybe when we pick up the body, maybe we will get that any kind of the fiber or kind of the scraping will be found on the deceased person's body, which we have to take it out and going to be examined. Taken as so external examination, external findings are very much vital. Taken sometimes we will get that to examine properly, we will get that the very minor prick, which gives you the clue that some kind of the intoxication has been given to that person. Taken, but in case of pathological thing, the external findings are not so important, except in skin manifestations of the systemic diseases. All the three major cavities, as I already told you, the head, thorax, abdomen are open. The spinal column is always open in certain cases, like in cases of the RTAs, free fall, or like are kind of the strychnine poisoning, some spinal poisons, then in that particular cases you have to go for that the for the autopsy of that particular spine area. Otherwise you will be focusing on these three major cavities, take it, but the rest of the other, like excluding that spinal issues. So you're not totally depending on the postmortem only, but you have to open these cavities as well. ठीक है जी. But in cases of the pathological autopsy, only the cavities containing the disease organ is basically open. Like if I'm just giving that the treatment for the heart and it's not worked up, like then I'll look for that whatever the changes are there in the heart. I'll only go for the thoracic surgery and perform and take the samples from there and go for that the analysis. Then the again we come to that the medico-legal autopsy. It is valid documentary evidence in the court of the law on your statement. It's जिसके ऊपर भी allegation होएगा, आपने अगर prove कर दिया उस चीज को, तो maybe he will get that the punishment with the court of the law. So you should be very much like specific or particular while making your findings, and unbiased should be like you should be unbiased while making that document. Okay, so it's a lot of responsibility on your shoulder while performing this autopsy. But the pathological autopsy, it is not a valid document evidence in the court of the law, but it can give you that the boost in your in your like upcoming regimes, and it will give that the kind of view or the kind of new perception towards your remedies. Take care. So for the sake of that, you will get that something like beneficial from performing this pathological autopsy. Now we come to that, what are the objectives, aim and objectives of the medico-legal autopsy? So, I mean, aims and objectives of the is to establish, to determine the identity of the deceased. Because as I told you, sometimes we get that the unknown body, we never know from where the body is coming from. To establish the cause and manner of the death. We already discussed what we really mean by cause of the death and what we really mean by manner of the death. Again, we will the cause of the death, like either it's that the traumatic or that the kind of assault is there. So we will look for the cause and the manner. Like we have to look for either the natural cause is there or the unnatural. If unnatural, then we will look for either the homicide, suicide, or the accidental, or to establish and rule out the foul play. Sometimes it just pretended, like I have attended multiple autopsies, even in that the previous recent months, there was the body of a lady was spot being found hung up and in her room, and that they said the issue was that unka dono ka husband and wife, they fought with each other, ladai hui, or after that she locked the room and she put her dupatta on the fan, and she committed the suicide. But at the time of performing the autopsy, we have seen multiple bruises on the body, resistant mark, even on the wrist there was that the finger marks was there, and with the help of the knot, or beneath the knot, there was that again that there was that the marking of fingers were there, like means somebody tried to suffocate her first, then she maybe just died because of that, then that the person has been hung up. Because when we dissect that area, we open that neck, we found the head was intact at that moment. So there are you have to rule out by looking forward, by putting your all the from which that the body has been retrieved, and performing that the autopsy, you have to look out कि जी कितना घंटा गुजर चुका है इसको मरे हुए, ठीक है, how much time has been passed out that the person has died, to identify the weapon or the poison responsible for the death. So being a specialist, you can rule it out. If a gunshot, then you can identify this is the wound of the entry and this is the wound of that exit, that the most probably direction would be like this and that. Yeah, आप उससे बता सकते हैं. The poison, for the poison, you will collect the samples and you will send for the chemical examiner to rule it out. ठीक है, on that the double check, you will make your diagnosis. In case of the newborn infant, when the viability is the issue, then you will look for, like, either the child was live birth or the dead birth. You perform that. The infantile, in cases of the infanticide, you perform the autopsy and rule it out with that the help of examining the lungs. Either that it was the live birth or the stillbirth. Hope I'm not going so fast. Okay, so now that the main important thing is pre-autopsy formalities. This is very important, guys, because whenever we ask you this question in the exam, you get confused. I don't know why, but try to understand all the points. Then I'll tell you that the one I have highlighted, the one that is the legal formalities, which is very much important. Basically, we want to get, take out from you this particular section, that is the legal formalities. Okay, so pre-autopsy formalities consist of visit to the crime scene, transportation of the corpse, registration of the dead body, storage of the dead body, legal formalities, some other formalities with the legal formalities, and place of performing the autopsy. Now take it one by one. So, visit to the crime scene. This is not being done, unfortunately, in our part of the world. Like in Pakistan, we are not doing this job. Like even in the India, Bangladesh, they were doing this job. Their experts go to the crime scene and they look for it, because whatever you see, you never forgot. It's that, this is the basic concept. मैं आपको कितनी भी स्टोरी सुना लूंगी, जब तक आपको एक दफा autopsy विजिट नहीं कराऊंगी, जब तक आप एक दफा एक्सपीरियंस नहीं करोगे, you never know about all the stories. It's like here, what we are doing, we are just hearsay stories पे ही believe कर रहे होते. FIRs है, inquest report है, आपका postmortem challan है. We were just depending on those documents and creating the pictures in our mind. So, visit to the crime scene. It's usually being not done in our country, but it is mandatory part of in the European countries. While autopsy surgeon usually visits that crime scene, and what he usually do, he cordon off that area. He look the position of the body in relation to the surrounding objects, take the photographs of that particular area, whatever that collect the trace evidences from there, any kind of object. They will collect that object, any kind of that, the fingerprints or the footprints, any kind of the trace evidences were there, they collect by themselves, take it, and they photograph all that crime scene. And unfortunately, हमारे पास क्या होता है कि जी police usually reach at that area, they were collecting the things by their hand and they were just destroying the evidences. ठीक है, इसलिए कि because fingerprints जो है वो destroy हो जाते हैं, or they put it in the shopping bags, so moisture destroys the evidences. ठीक है. So we should be very particular about these things. We were just working on it. At the crime scenes, doctor should be the one medical legal officer should be give access to before while performing the autopsy, they should go and visit that area. Now the second part is that after doing that job, there is the important thing is that transportation of the corpse. Transportation of the corpse should be in that the mortuary, towards the mortuary, in the plastic, there is the deceased के लिए जो है वो एक बकायदा वो plastic bags designs हुए होते हैं in which they put that body and tie them from the both ends, ठीक है, and they will just put the body with all their belongings, and never try to take anything out from it, कोई necklace है, chain है, कुछ भी नहीं, nothing. They took it as it is, that the body towards the mortuary. Now the third step was registration of the dead body. Once they were just transported that body on the receipt of the corpse, authorized staff should make entries in the two registers. There are general register or the autopsy registers present at that particular mortuary. So column of the general registers usually contains serial number, date and time of the receipt of the corpse, name and ID card of the deceased if available, take a name and number of the police officer in his police station. We should write it down. Take a date and time of the delivery, return back to the corpse to the police. That should be written, and that particular journal. Then the column of the autopsy registers are दो register, as I already told you कि दो होते हैं. Then the autopsy register में आप क्या लिखते हैं? Biodata of the deceased, year number, like कौन से साल में autopsy हो रही है, like 2020 में. If we will just start up with that the autopsy, we will write down that the 2020 autopsy number, like जो भी नंबर इसको अलॉट करेंगे आप, नेम, डेट एंड टाइम ऑफ द autopsy, name of the performing individual who was just performing that autopsy, date and time of the autopsy should be written on that register. Detail about the specimen collected with the name and number, like if I'm just collecting the heart, I'm sending the kidney, whatever that the viscera and how many jars I'm sending, I have to name and label them. Take care and write down the numbers of it. Then the date and time of the dispatch of the specimen and name of the lab we're sent and with whom, like जो policeman लेके जा रहा है specimens, उसका नाम लिखेंगे. Date and time of the dispatch is going to be mentioned over it. Lab बताएंगे कि जी where we are sending it to the chemical examiner lab. जो हमारे साथ, अगर if I'm just talking about my system, then we have the chemical examiner lab at the civil hospital, so we send it there. Then the provisional or the final conclusion regarding the cause of the death is being written on that particular register. Storage of the body, there are two type of the storage. We put the body like in in two scenarios, like pre-autopsy, like short term, that is +4 degrees centigrade for the autopsy purpose. Like in that the tissue is not going to be that much freeze enough, like it's going to be cold storage. And agar isse zyada pe rakhte, if you're going to put more than this, then the tissue is going to be frozen up and we won't be able to perform that, like histopathology of that particular tissues. So we will destroy that thing. So we usually kept that for a while, like before that they performing that autopsy, we keep that the body in that the 4 degrees centigrade. After performing that autopsy, you can keep the body till the procedure of the dispose off time, like you can take it up till like -20 degrees centigrade. You can preserve the like body up till that temperature. Now we come to that the legal formalities and autopsy protocols. Sometimes or always we ask this question in the exam, and I don't know what you guys tell, like every time, like you start off with the something very different. I don't know from where you like study, तो पता नहीं कहाँ से पढ़ के आ जाते हो, लेकिन यह है कि this is something which I'm telling you, ये बस आप याद कर लीजिएगा जरूर. ठीक है? Scrutiny of the police papers, सबसे पहला काम, once that the police officers comes to you, you have to look for the authorization order from the police or the court. You have to look for the inquest report, the copy of the FIR, inquest report, the copy of the FIR, the same thing, like कौन सा form है, alif बेजीम ABC, कौन सा, which form is that, that particular one, initial MLC अगर मौजूद है, if the medical legal certificate is along with that particular case, treatment note, hospital note कोई है, वो आपके पास होना चाहिए, lab x-ray, MRI, etc. report, any operational notes. ठीक है? These all documents should be scrutinized first. So we'll take it one by one. ठीक है जी? So for the protocol, we look for the authorization. There are certain conditions, and to whom we have to take that the authorization, like in the routine cases like accident, suicide. So we will take that the permission from that the police sub inspector, that is ASI, assistant sub inspector जो है वो आपका होता है, or we can take that the station house officer, SHO से जो है वो is the person who just give you the authority. But internationally, what usually happens, KG, coroner is that the person who usually give. Police can only request to the coroner for conducting the autopsy, and coroner is the one who just give the order and perform the autopsy. Okay, ji? And for the homicidal deaths, if that the foul play is gonna be involved, so we will look for KG, the circle police officer, like DCP, Deputy Commissioner of the Police, or the ACP, they can give you the permission for that. In cases of the exhumation or death in prison, police custody, or police firing, executive magistrate usually give the authorization for performing the autopsy. Now the second part is that after the authorization, you will look for the dead body challan. It is the requisition submitted by the investigation police officer to a medical man who was just going to perform while handing over the body for performing the autopsy. It contains the name, age, sex, sometimes religion of that deceased, as well as suspected cause of death and the purpose of which the body is sent. It also gives the place, the distance from where the body has come, the name of that particular person accompanying the body for protection and identification, the detail of the articles and the clothes with it. उसकी जितनी भी belongings हैं, वो सब उसके ऊपर डेड बॉडी चालान पे मेंशन होता है. The medical legal officer should fill up the columns indicating the time and arrival of the body in the mortuary and the time of the postmortem examination and that particular dead body चालान. एग्जामिनेशन ऑफ द पुलिस जो है क्या कहते हैं आप डॉक्टर जो डॉक्यूमेंटेशंस होते हैं दैट इज लाइक पुलिस रिक्वेस्ट फॉर द autopsy or it is requisition submitted by the investigating police officer to a medical legal officer by handing over the dead body for the postmortem purpose. You can say आपका डेड बॉडी चालान हो गया. FIR है, it is a report, first information report, that is it is the report in which the available history of the case and the circumstances under which that the body was found or recovered are recorded. इसमें आपको हर वो चीज़ पता चल रही होती है कि जी उन्होंने कहाँ से इसको रिट्रीव किया, बॉडी किस कंडीशन में पड़ा हुआ था. It also contained the recorded opinion of the witnesses, like surrounding में जिन लोगों ने देखा, the people who have seen or noticed that incidents, उनके statements भी उसके ऊपर होते हैं, and the police officers regarding that the injuries being mentioned according to their criteria, manner of their causation, the cause of the death, the indication of the suspected foul play, if any, they all are going to be mentioned in the like particular FIR. That FIR, as I told you, ke alif beijing. Remember in the previous slide I said ke ji here के फॉर्म जो है वो उसके होते हैं FIR के. There are multiple FIR forms. We call that A, B, C or Alif, B, G. So these are the particular, like, whenever the person reports for like natural death, so they put that like, in the form A or Alif. For those cases in which the death has occurred due to the assault, then they put like B, that is B. And that for those cases in which death appears to be due to the poisoning, that should be in gene, that is called form C. Let me show you that one of the example. Look here, this is B, so most probably this is the assault case. Okay, so this is the paper of FIR. This is such thing which we called FIR. ठीक है, इस तरह से इसको fill किया जाता है in Pakistan. Now that the other fees made, the main thing is that now we have gone through with the authorization letter, then we have the look for the postmortem challan. Okay, then authorization में you have to check कि जी either it's for you or for somebody else, आप ही के नाम पे होना चाहिए. ठीक, postmortem challan हो गया, then you have read all the documents related to that, the FIR. ठीक है, then you will go for the identification. The dead body should be identified prior to that performing the autopsy. It is necessary because in a mortuary, when serial autopsies are done, multiple autopsies हो रहे होते हैं, like people just taking out from that the refrigerator and the hydraulic trolley, multiple, sometimes the tech will be get messed up, so you won't be able to know कि आप किस पे autopsy perform कर रहे हैं और आपने किस पे करनी थी. So you at least you should be very much particular about that one. ठीक है, कि जब आप बॉडी रखा जाता है वही नंबर है, you have to check the tag जो भी आपका उसके साथ बॉडी के साथ अटैच हुई होती है कि either you're taking the right body or not. This can be prevented by appropriate identification. The body of the deceased should be identified by the police constable who brought it. ठीक है, write the name with address, number of the police officer, उसका belt number होती है, with the police station from where he came from. It should also identify by two relatives with the names and address of the person, or take the signature from them, and the fingerprints. Or if the body is unknown, ask the police to take the photograph. Note particulars of the dress worn on, that tailor tag hai, belongings hai, facial features hai, height, weight, आप देखेंगे वो सारी चीजें मेजर करेंगे, नोट द फिंगरप्रिंट डिटेल्स, ठीक है, एंड देन गिव एन एडवर्टीजमेंट ऑन द न्यूज़पेपर टू रूल आउट, ठीक है. और अगर इफ यू विल won't get that the any kind of, then you can dispose of for that the teaching purpose or something like that, even for that the medical legal department for that particular job to involve the body, ठीक है, उसको involve करके जो है वो use करते हैं teaching institutions. Then, along with that, the other formalities, we look for that the initial medical legal report, if there is any, treatment note, if there is any, where there has been a prior treatment between in the act of the violence or between that the accident or the death. Such documents are we have gone through with this all this, and that formalities is comprises of authorization, that is like basically authorization, we look for the authorization कि किधर से किसने भेजा है, what is the cause of like sending that, like accident है तो SHO भेजेगा, because in these three criterias, if the magistrate is sending for the accident, that is something totally not understandable. For the homicidal, ASHI or SHO cannot order for that for the autopsy. So you have to be very careful, like while look for the authorization letters. Okay. Then we look for the dead body challan. I already mentioned कि क्या होता है. Then you look for the first investigation report, FIR. You have to be very particular about that thing. You have to look कि जी which form is this one, like कौन सा alif है, B है या jeeb है. ठीक है. If it's gonna be alif, then it's gonna be like natural death. B Bay, that is going to be related with that the assault, and going to be C, that is related with that the poisoning. C, like here, that is Bay, like it's belongs from the B category, so it's a case of the assault. Okay, this is the FIR. Now the other formalities, that is the most important one, that is the identification. To make or establish the identification is very important, because like sometimes what happened kiji, you have that the loaded up with the multiple bodies in the mortuary, so maybe the bodies get mixed up and you perform that the autopsy on the wrong person, wrong individual, wrong deceased. So it's very much important to make the identification first, because sometimes the tag get mixed up when you put the body, that the tag may be misplaced or something like that happens, like misfortunes happens. So for that you have to establish your identification first. For this you can take the help from that, you have to take that help from that the police constable who brought it, with his name, address, his belt number, number of the police officer, from which police station, name, address of that particular persons, and their signatures, and with their fingerprints. Okay. Then if the body is going to be unknown to towards you, then what you have to do, like first ask the police to take the photograph for that, note the particular of the dress worn, ठीक है, उसका belongings है वो देखेंगे, facial uh, features, and look for like assessment of the age by checking the dental assessment. You will look for particular, you can rule out that the age of that particular person, take care, or any kind of the identification mark is there. Note the fingerprinting details, आप उसका लेंगे, ठीक है, give an advertisement on the paper, आप उसको जो है advertise कराएंगे. Or if that other formalities along with that the identification, maybe you will get that the any kind of the medical legal report, or that the treatment note would be along with it, where there has been a period of treatment between the act of violence or between that the accident or the death. Such documents are necessary as to enable the doctor to serve as a guide to retain or send appropriate part to forensic science laboratory. But it's the rule of the thumb, I'm telling you, okay, you have to open all the three cavities. But here, once you will be know कि जी traumatic asphyxia है, ठीक है, ribs are fractured, then your focus is going to be on over the thoracic cavity. If it's going to be like hanging है, strangulation है, so your focus is going to be on more on the neck and the upper thoracic kind of that cavity. If it's going to be like fall, है, ठीक है, accident है, then the cranial cavity is going to be your major focus, like, instead of that the rest of the two cavities. So these kind of the notes will sometimes give you help, like, to take or approach that particular area first. This is the medical legal, like, kind of the performance which we have to fix. After just having those documents which I told you कि postmortem challan and जो है वो आपने fill करना होता है, sign करना होता है, then you have to give it back to that particular police who has just bought that postmortem challan along with that the authorization letter. You keep that the authorization letter and sign it out that the postmortem challan, ठीक है जी, with the time of starting up that the autopsy, ठीक है, with your name and detail. This is that the perform, as I told you, postmortem number. It's mentioned on that which hospital, civil hospital hai, Abbasi Shaheed the hospital hai. We have that the particular hospital's dates, memorandum of the postmortem examination held at Dash Karachi on dead body of Dash by Dash. General particulars में by whom was the corpse sent, by whom was the corpse brought, by whom identified. Remember अभी हमने पीछे किया कि दो उसके identified होंगे, exact time of its receipt, ठीक है, exact time ये जो है we can take it from that the registers, right, जो हमने किया, that exact time of the completion of the postmortem examination we have to submit that one, like starting time or end time we have to like write it down. Then the external examination में क्या क्या देखा आपने वो सब आप you have to mention it, like it's a performer like that, आप उसको fill करते जाते हैं while performing. It's a cranium and the spinal cord performer, like देखिए इसके अंदर दिया हुआ है Lavol's ribs and cartilages injured, pleura injured, larynx and trachea, thank you, healthy, left lung injured, pericardium injured, ठीक है, इस तरह से you have to fill all that, like viscerals, whatever you will just see, you have to write it down. ठीक, then the injury you have to mention as mentioned in the injury sheet. ठीक है, disease or the deformity कुछ भी नहीं मिला, remarks by the medical officer. In my opinion, the deceased died due to the injury to the left lung and heart due to firearm. ठीक है, तो ये firearm का केस था. Look, that this is how you examine, like there is no injury is going to be there. Hair, these kind of the figures are usually being present on that performer, then you have to make that the identifying, like one of entry or one of exit, you have to mention like that. Okay, so that is all your autopsy protocol related things. That is authorization, dead body challan, person investigating report, FIR. Then you have to look for like a identification and all that, then the procedure got be started. Okay, place of performing the autopsy, basically a mortuary. What is mortuary? Basically, it's we don't perform in the mortuary. Mortuary is basically the place or the room or the building, usually be the part of the hospital to which dead bodies are kept or taken there to be kept for the until their burial or some other disposal. Autopsy room is the part of that particular mortuary where the dead bodies are dissected. Okay, so this is kind of that the autopsy room. The protocol for the autopsy is they always be done in the sunlight. It's recommended and not to be done. It's, as I already told you, it's not the critical or the emergency sort of thing. It should be, doctors should take their time to make that the proper diagnosis. Or if you don't find anything, no need to make anything. Write it down whatever you have seen or send the samples. Okay, it's not mandatory to just write it down कि जी cause लिखना बहुत जरूरी है. If you don't find anything, say nothing is being found related to that particular whatever that the FIR says or the dead body challan says. ठीक है, so आपको जरूरी नहीं होता कि every time you will get that the cause play with that whatever they were just assuming. ठीक, what is the reason for the daylight? Because the body changes. It is recommended that it's very hard to see in that they artificial lights to look for the jaundice, look for that the color of the bruise changes, become like a little bit change, or the postmortem staining becomes little bit change, in that the artificial light. So it is basically recommended to perform the autopsy in that the daylight. There are certain instruments which usually being used in the procedure of while performing that the autopsy. So let me conclude my session by, like, what we have done. We have done like what we really mean by autopsy. There are multiple synonyms for the autopsy. It's the scrutiny of the dead body, internal or external examination, to rule out that the foul play in cases of the unnatural or the sudden deaths. Okay. Acha ji. The other thing is that what we have done, it's that we have gone through with the types of the autopsy. There are multiple types, and but basically we focus on that the like pathological autopsy or the medico-legal autopsy. Other than that, there is psychological autopsy, that is non-invasive sort of thing, and which is related with the interview of that particular deceased family. Okay. Then we have the autopsy, we have anatomical autopsy. Then again, we just moved on towards the what is basic objectives while performing the autopsy. We have done like that the what are the prerequisites, like visit to the crime scene, how we dispose of, take out the and take the body, uh, uh, execute the body from that crime scene towards the mortuary. आपने कैसा shift करना है. Then we have the like legal formalities, which is like authorization हो गया आपका, dead body चालान हो गया, FIR हो गया, identification हो गया. Then you have to look all these things. ठीक है. And then finally we have done that why we were just performing that autopsy. ठीक. And so this is all for today's lecture. In the next lecture, inshallah, we will start off with that the external and internal examination. Hope to see you guys soon and stay safe. Thank you.
Oh, okay, ma'am. Thank you so much. And now we will move to
Yes.
Student can ask question on chat, and the students also raise their hand, so I will unmute their mic.
Sure.
So students, if you have any questions, so you can try both the option. Thank you. Chat is open for the question, so student can also type their question in the chat box.
Ravinder?
Yes, ma'am.
Can I see that chat box?
Yes, ma'am. In the more option.
Okay. Okay.
Ma'am, no any raised hand or the question in the chat box, so can we assume that all things are clear at the student side?
अच्छा बेटा इसमें सिर्फ एक क्वेश्चन है
अच्छा, हाँ हाँ. यस मैम, आपको दिख गया ये अफरीन मोहम्मद जी.
हाँ, what is the difference between the cause and manner of the death? Beta, basically, cause and manner of the death. My manner is basically is related something with, like, with the like either that it is, if we talk about that the unnatural, take care, either the homicide, suicide, or the accidental. ठीक है. So we take the manner in these three particular headings. ठीक है. And the cause of the death could be like natural हो सकता है, traumatic हो सकता है, could be accidental हो सकता है. ठीक है. Could be suicide हो सकता है. ठीक. But like manner को particularly हम तीन categories में fall करते हैं. लेकिन manner it's very hard to give, like because आप हमारे पास we don't have, like we don't visit that the crime scene. So we are very blindly just making this a statement. So it's better to give that the cause instead of giving that the manner of the death. ठीक है. कि either that the death has been occurred naturally or that the unnaturally. ठीक है. And the manner is basically something related with the homicide, suicide, or the accident. ठीक है. Hope it's gonna be clear. Okay. The other question from that the Afreen is like clinical and the anatomical autopsy. Clinical beta is something related with, like, as I told you, pathological autopsy is being done in that the, like, in the hospital settings, when we will just look for that the course of the disease या कोई नया trial है, we have to rule out why that particular drug has not been affected or that particular organ or the viscera. Then with that the approval of the relative, we perform that autopsy. That is, we called it clinical autopsy. Anatomical autopsy is now being obsoleted. Like previously, when, like, for the purpose of the dissection or to just let the student learnate with that the with the body emballed करके जो है वो dissection halls में रखे जाते थे, and they will just put the dissection के जी these are the incisions, these are the planes जो आपके anatomical planes हैं वो body के ऊपर बताए जाते थे. Then they will just tell us कि जी these are the pectoral muscles. Each and every layer is going to be open day by day by giving that the, like, detailed description regarding that the nerve supply, arterial supply, and all that thing being dealt under that anatomical autopsy. Why crime scene is now visited in Pakistan? This is totally just make that to conclude our diagnosis or to come up with that the final verdict, because, like, it's totally lying on our shoulder to give that these statements, such a statement which can be, like, give the punishment to that somebody, like, who's being accused for or being like considered as kg he's that the person is the that is the salient for that particular event. So it's very true कि हमें हमारे पास भी ये setup होना चाहिए, because once you have seen you never forget. ठीक है, तो ये होना चाहिए. अच्छा जी. How much time it takes to make a proper autopsy? बेटा internationally there are, like, pathologists तो वो एक एक हफ्ते भी रख लेते हैं, because they would just take out the body, they take out the viscera, then they sometimes they dispose of. In the next section I'll tell you the different techniques which is being used internationally or here, like, but we are the one who are just performing, like, कि हम एक ही दिन में perform करते हैं, एक ही दिन में उसको hand over कर देते हैं. हम अपना सारा जो भी collections हैं, specimens हैं, we send them to the chemical examiner, histopathologist को जो भेजने होते हैं वो करके label करके. Sometimes we come to the conclusion by seeing all that the internal findings पे खुद ही हमें पता चल रहे होते हैं. लेकिन to counter check all these things we send that the things towards that particular areas. ठीक है, लेकिन यह है कि internationally sometimes they keep the body for the long time and they do these practices by their own selves. ठीक है, but we have that the specialist for that. तो हमारे पास से वो बकायदा उधर जाते हैं. जैसे pathologist is very like being trained in, like, in performing that the histopathology and all that thing. So they were just performing all these jobs by themselves internationally. ठीक है. Thank you. Formalities of the autopsy बेटा अभी हमने किया था. फॉर्मेलिटीज़ ऑफ द ऑटोप्सी के अंदर वही है आपका कि आपका ऑटोप्सी प्रोटोकॉल से रिलेटेड अगर आप पूछ रहे हैं, फॉर्मेलिटीज़ के अंदर तो सारा आ जाता है. क्राइम सीन विजिट करना है, देन यू हैव टू हाउ यू जस्ट transport द डेड बॉडी, देन यू जस्ट रजिस्टर, like, when you reach the mortuary, then you have two registers, then जो है वो आप उसके अंदर उसकी एंट्री कराते हैं. then, like, then the procedure starts up. then the legal procedures, legal formalities के अंदर आपका आ जाता है कि authorization है. authorization usually being it's an authority being given by the legal authorities, like police है. आपको मैंने different types बताए कि routine cases हैं उसमें SI SHO भी आपको दे सकता है, like accident और suicide case के अंदर request can be generated from them. but the homicide में DCP और ACP से काम के rank का बंदा आपको ऑर्डर नहीं कर सकता. But in cases of the exhumation, like when the body is being buried up and again digging out of the body, being ordered by the magistrate, ठीक है, or that the death in the prison, like somebody has been died in the while in the prison, or that the police custody, or by with the police firing, ठीक है ना, तो उस कंडीशन में भी मजिस्ट्रेट आपको उसका ऑर्डर करता है. ठीक. देन उसके बाद आपका जो है डेड बॉडी चालान होता है, एफआईआर है, दैट्स को इंक्वेस्ट रिपोर्ट भी कहते हैं. देन अदर फॉर्मेलिटीज के अंदर आपका आइडेंटिफिकेशन है, विच इज़ वेरी इंपॉर्टेंट, एंड एनी काइंड ऑफ द इनिशियल एमएलआर जो है, मेडिकल लीगल रिपोर्ट अगर आपके पास मौजूद है या ट्रीटमेंट नोट है, देन यू हैव टू लुक ऑल दीज डॉक्यूमेंट्स बिफोर स्टार्टिंग अप द ऑटोप्सी. ठीक है. सनलाइट, लाइक ऑटोप्सी रूम जो है वो उसको डिज़ाइन ऐसा किया जाता है, इट्स बीइंग डिजाइन्ड इन सच अ पैटर्न दैट इट हैज़ द प्रॉपर वेंटिलेशन एट द below area, and we have that the open like ventilators or the windows from where that the sunlight can be enter into the room, and there would be like ice marbles should be placed in that the autopsy room. ठीक है, ताकि जो है वो एक प्रॉपर सनलाइट इफेक्ट पे जो है लाइक इट गिव्स यू दैट द क्लियर कट, लाइक आपको फाइंडिंग्स दे रहा होता है, बट यू कैन easily see that the joint is there. You can easily see the color changes of the bruises. You can easily see that the postmortem staining changes जो color है वो उसको identify कर लेते हैं. It's a standard and that the recommended thing. ठीक है, but like sometimes जब आपके पास after the 5 p.m. it's not recommended to perform that the autopsy, but sometimes that like that the custodial deaths, like वो आते हैं तो रात में ही आ रहे होते हैं, then you have to perform, like you have to request them कि जी मजिस्ट्रेट साथ आया हुआ होता है, then you have to request them कि जी ठीक है, you will doing that the postmortem external findings, you would just record them up and you solve कि जी इसके बाकी remaining I'm going to put that in the cold storage, and I'm going to perform that the in external again in that the early in the morning. So basic आप उसमें रिकॉर्ड कर लेते हैं, फिर बाकी आप उसको मॉर्निंग में करके दे देते हैं. ठीक है. Okay. Hello, Ravinder.
Hello, ma'am.
G. So these questions are all done, hopefully. और अगर फिर भी कुछ रह गया हो, so they can ask me in the next lecture as well.